Hello, welcome back. The topic today is nosebleed, or the medical term is epistaxis. The nosebleed is very common. You can say out of 10 people, at least 6 people would have had once in their lifetime experience bleed from the nose. So in this video we'll see what are the reasons, what should we do, what should not we do. Okay. The purpose, the nose actually is an organ through which the air usually enters. Actually, the nose is connected to the sinuses and even to the ear through the eustachian tube. So it has a mucus secretion. The reason being, so the air goes and goes out. If you see when you exhale the air, you can see the warmth, the heat in the air. So that means that area can become dry. To avoid the dryness, we have the mucus secretions normally. These mucus secretions generally they dry up and they make up, they clump together and form a dirt. So usually what we do, we pick the nose and clean the dirt. Okay, when we do this nose picking too seriously and too vigorously, the superficial blood vessels, the nose has a lot of hair and superficial blood vessels. The purpose of this is to, to dissipate the heat. So in the previous video I have told you, wherever we have hair, it will be always warm. Axilla, head, pubic hair and all. Because the reason is, the hair follicles are over the superficial blood vessels. The blood vessels in that area are very superficial, they are very big, and the hair follicles act as a radiator, you can say, or they dissipate the heat. So when these hair follicles, when you pull the hair follicles or you trim it, it irritates, and you pick the nose and bleeding can happen. Okay. Who all can get nose bleed? Anyone can get. In children, the commonest is very common between 2 to 10 years, because they don't know how to clean the nose. So the nose picking is the first reason the children for the bleed. And foreign objects, children they insert anything foreign, especially pencil, pen, any sharp objects, so they can injure the nose, the superficial blood vessels, then they can bleed. These are very common. And of course they have running nose, too much of running nose, and it keeps on irritating the nasal mucosa next, they keep picking it and it can bleed. So any infection also. In the middle age, usually the same, all the reasons like nose picking, foreign body, and very importantly in middle age hair growth is too much, so they pull the hair or they trim the hair, that irritates, and again it can bleed. This is one part. And other thing is medications, especially blood thinners like aspirin given for the cardiac reason. So the blood thinners can easily make them to bleed. These are the reasons for the middle-aged people. And old people, of course, because of the age, medication, atherosclerosis of the blood vessels, again dryness of the nose, and the dirt stick together. All these things can cause bleeding. The general reasons for the nose bleed is, first is nose picking, second is foreign objects, third is cold. Suppose you have an upper respiratory tract infection, running nose, they irritate, and you keep blowing your nose to clear out the mucus secretion, the running nose. What they do, they keep blowing it just to clear it off. So injury can happen and bleeding can happen. These are the very common things. The other is allergic rhinitis. So people, the morning wake up, they keep sneezing. So what means it's allergic rhinitis that can cause bleeding, or sinus infection, severe sinus infections can cause, the middle age, very common is blood thinners, they can cause, and some people with bleeding, clotting disorders, blood disorders like hemophilia, they can bleed. And people with polyp, people with a septal deviation, usually it's not symmetrical. The nose is not symmetrical, so one side deviation, so too much of injury on one side causing an injury and bleeding. Even polyp formation can happen because of the DNS, and the polyps can bleed very easily. And if it's a lower side bleed, usually you can see the upper, or what you call the inside, if it bleeds, usually it goes behind and it can come through a mouth, through the saliva. So most of the people say in saliva I see streaks of blood. It could be from the mouth, oral cavity, but sometimes it could be from the back of the nose or upper part of the nose that can bleed. Okay. sometimes very rarely because of tumors in the upper aerodigestive tract system can cause bleeding through the nose, and very rarely suppose you're bleeding in the inside the nose, and there's especially with bleeding disorders, hemophilia, or people with cirrhosis where the clotting system is not good, and if suppose for some reason it bleeds, and if they're sleeping, they're lying back, the blood flows back. If it's a very small bleed, it can come through the saliva, or it goes directly into the food pipe and go to the stomach. That can cause nausea, vomiting, even blood vomiting. And very rarely, sometimes they don't bleed. If the bleeding is excess, it goes down as a black color motion. So, black color motion, even the upper aerodigestive bleeding could be a reason. And of course, tumor could be another reason. Okay, what to do when it bleeds? You have a children or somebody, or in the night time it bleeds, and as a first aid, what should we do? First and foremost is don't lie down, sit up, and if you want, you can bend a little more down. Put your head down a little down, and breathe through the nose. Let whatever the bleed in the nose, let it come out, and you breathe through the mouth. Then pinch your nose, the soft area, not the hard area bone, with a plain finger or even some kerchief, and at least minimum 5 minutes you just hold it, or very rarely it may need 10 minutes, but at least 5 minutes, because the 5 minutes is the thing for the clotting time. So after 5 minutes usually it will stop. Once it stops, maybe you can apply some ice packs. The ice packs again constrict the blood vessels, so they can stop bleeding also. But once the bleeding is stopped, 2 things or 3 things you have to do very important. You should not do very important. Again, don't pick your nose to see whether it's bleeding. Number 2, don't blow your nose. When it bleeds from the nose, don't ever blow your nose. Picking and blowing your nose is absolutely contraindicated after the bleeding or after the bleeding stops. This is very, very, very important. And third thing we always say, don't put pressure, weightlifting, or some forceful, or where your blood pressure increases that area, that you should avoid. Like squatting, weightlifting, all these things you should avoid. Bending, all these things should be avoided. So nosebleed is very, very common. It happens to anyone once in a lifetime. But if the bleeding is more, it's not stopping, even after 10 minutes or 20 minutes, the bleeding is not stopping, the quantity is very high, and you feel nausea, vomiting because of the bleeding, and if you are taking cardiac medicine, or if you know a hemophilia patient, all these people should immediately seek for medical help. And the doctors again, they will examine, ask for some questions, and they may order for some blood tests or even CT scan or whatever the scan, and as a first aid they may do something to stop the bleed. So bleeding is very common, and you do the first aid yourself, and in spite of all these things, if it bleeds more than 20 minutes and if you have medical problems, seek help. Thank you.